I'm Jennifer. My research focuses on the use of bacteriophages to treat bacterial infections. So since their discovery and widespread application in the 1940s, antibiotics have revolutionized modern medicine. They've saved countless lives. Unfortunately, the emergence of resistant bacteria, paired with a lack of discovery of new drugs, threatens a return to the pre-antibiotic era. One of the few hopes to stave this horrible trend is the use of these awesome viruses called bacteriophages, or phages for short. Phages exclusively target bacterial hosts and so are generally harmless to humans. They infect a bacteria, replicate inside that cell, and then burst the cell open to release their progeny. In this way, bacteriophage can be used as a tool to target and eradicate specific bacteria in a practice known as phage therapy. Phage therapy is not even a new concept. It's actually over 100 years old. But the ease of application and efficiency of modern traditional antibiotics meant that phages were basically all but forgotten in Western medicine. It's only now that antibiotics are starting to fail that we're reconsidering phage. Actually, in Eastern Europe, phage therapy has been practiced nonstop since its discovery, but large-scale studies are rare and small clinical reports are often unreliable. Although positive reports are frequently reported, the effect that phage therapy could work, the promise of phage therapy working is not always guaranteed, and the reasons for its failure are not often understood. And since each bacteria can usually be infected by more than one phage, the choice of which phages you use during treatment is critical. Phage therapy, therefore, would benefit from a large-scale study of efficacy and each phage's differential ability to infect a particular bacteria. In the United States, phage therapy is limited to last resort circumstances where antibiotics were used and have failed. These desperate circumstances remove the luxury of time from choice or preparation of phages. In addition, the prior use of antibiotics means that phages are going to be used to infect cells that are likely adversely affected by the presence of these drugs. This is where my research comes in. I'm going to explore if the presence of antibiotics, along with the other conditions inside patients, is affecting phage therapy, and if phages might be pre-adapted to be better suited for these conditions. Although phage therapy is unlikely to be the magic bullet that saves us from antibiotic resistance, we need to explore and improve alternatives like phage therapy so that we can reduce our dependence on traditional antibiotics. Thank you.